So once you get a patient admitted into the unit, you are requested to enter the demographic data as soon as possible so that you can create an identification number. You can see I just opened this page and I have a patient ID. This number has been generated automatically by the system. And then you have to fill in the answers for this patient. Inclusion criteria: was the neonate less or equal to 44 weeks post-conceptional age at admission in the unit? You have to answer yes, otherwise the baby does not fulfill the inclusion criteria. So now let's fill in the name of this patient. This is for sex, it's male newborn. Date of birth. The date of birth is in the day, month, year format. You can have at any instant some help by just putting the mouse over the question mark. Here you can either enter the date, exactly day, month, year, or go to a calendar and choose the date that has to be in it. Let's say, for example, we will fill in the date of a patient that entered September the 20th and left the unit on September the 23rd. So we click here, the out of birth, which will be in a 24-hour format. This was a vaginal delivery. It was at 32 weeks plus 2 days. The birth weight was 100 grams. The Abacus score was 8 and 9. The patient was born in this hospital. No, actually it was a transfer. The date of admission, you received the patient 2 hours after his birth. So it is the 20th. Let's say that you received this patient 20 hours. The patient was already intubated when entering the yes. The diagnosis can be completed later on, but actually you already know for this patient that the patient had respiratory distress syndrome. So since you already know this diagnosis, you can fill in this diagnosis, but you can complete the questionnaire later on once the patient is discharged. So you can come back to complete this later. Date of discharge, at the present time you don't know yet, but if you do it once the patient is discharged, of course you will know all these dates. So we will complete this data later. Then the second part of the patient page is shows you how to fill in the clinical risk index for babies. So you can see that the birth weight of this baby was more than 130 feet. Gestational age more than 24 weeks. There are no congenital malformations. The maximum base excess in first 12 hours was normal. We should say that if the patient didn't have any blood gas during the first 12 hours, the last 3 items are actually 0. Minimum appropriate fraction of inspired oxygen during the first 12 hours. Actually, this was a 40%, and maximum, let's say that you at the moment had 80%. You see that when you click on this, the total crib score will automatically be calculated. Once you complete this page, you should click on next to go to the next page.